You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to part 3 of our Specia 2025 series, where we've been sharing key conversations from this year's Access to Pharmacy conference in Las Vegas. Throughout this series, we've heard from both exhibitors and attendees about the trends, challenges, and innovations shaping the pharmacy space. Today, we're wrapping things up with a final round of insights brought to you by PrimeRx. Thanks for joining us throughout this series. Now, here's part 3.
PrimeRx here at Access 25, Access to Pharmacy. Ketan, it's so good to see you.
Hey Todd, it's always nice to be with you guys.
All right, so, specialty pharmacy, that was something that I struggled with. I came out of long-term care pharmacy, started working in software systems that would combine a long-term care setting and our community setting and how they were managing the facility versus the individual patient. And then all of a sudden I started learning about workflow in the specialty sector. Something special about what was MicroMerchant transforming into PrimeRx is the fact that your organization has centered on community, long-term care, compounding, and now, of course, specialty has all been a part of how important it is to an organization that focuses on specialty pharmacy to kind of manage their business. Talk to me about PrimeRx. Why are you guys here at Specia 2025?
So Todd, I think you all said a lot of things that sort of resonated with us. We've been focused on helping pharmacists, period. And pharmacists, all they do is dispense drugs, obviously the clinical intervention. And that's how we started in the business. But as the business of pharmacy changed, we realized that we needed to change. And that's the reason why we went into long-term care pharmacies, physicians' offices, mail orders, and obviously the specialty pharmacy. And believe me, it's not something, a cookie-cutter solution. It's something that means different for every pharmacy. The reason is because in the business of specialty medications, you are not just dealing with the patient. You are dealing with the patient, and obviously there's a lot of information that needs to be captured that goes beyond a standard pharmacy management system. So there may be scenarios where a pharmacy is maintaining one particular disease state and has expertise in that, and also has a option to go through URAC and JCO and ACHC and get a seat at the table. That doesn't mean that just because they have a seat at the table and they are URAC accredited, they may get the job done. So what it requires in order for you to get the job done is access to the different elements that surround the patient, give them access to the data as and when required in a secure manner. And the ability to board a patient or through an intake and ask relevant questions about that particular disease state is extremely important. Before dispensing, there are checklists that a pharmacy needs to do. Post-dispensing, there are items that the pharmacy needs to capture. And then all this information needs to be made available to physicians. There are manufacturers that are involved in here, and there's a lot of that kind of handshaking happening across the different elements, right? So we started off from a clinical assessment portion where we asked the pharmacy, hey, how do you want to handle these questions? And every single pharmacy had a different answer. The way that a clinical pharmacist operates and thinks about a particular disease state is very unique to that particular organization. So we knew that a cookie-cutter solution would not work, which is why we went into clinical assessments and gave them the ability to create their own questions about disease states, have assessments completed, have welcome packages, communication with the patient, with the text messaging or the phone call, that needed to be captured. All the different touch points that happen in a specialty medication dispensing, they needed to be captured and reported on. And that's where the complexity grew. And we realized that this is not something that can be done with a standard pharmacy management system. So we just kept on evolving our software and had the web portals so that way the sales reps and the physicians can get access to data, have data being reported to manufacturers, and so on and so forth, right? I mean, just the fact that I haven't paused for the last 3 minutes, even for 5 seconds, that means there's a lot to say and do over here.
But the reason why I want our listeners to understand this is PrimeRx is unique, that you're not buying multiple platforms in order to hone in on the very specific way that your operation has to run based on the fact that specialty pharmacy is much different and has more criteria to disease state management and reimbursement and coordination of care than a community pharmacy that's filling an antibiotic. And those are two environments. It's like high prescription volume versus lower prescription volume, but the lower prescription volume requires disease state management tracking and data collection and REMS reporting and like all of this specific things. And what's unique about PrimeRx is you've designed this all out of a platform that has evolved in multiple ways where you're able to deliver long-term care specificity, community, and now, of course, specialty.
Yeah, absolutely. And, you mentioned a variety of things. There's a patient's assistance program that needs to go through. And then the size and operations of pharmacies. We have had organizations that have call centers that basically work with those pharmacies, and those call center personnel live in their CRM. So we actually developed PrimeRx as a service middle layer that stays between the CRM and the actual pharmacy management system. And the personnel from CRM or the call center people can actually help the patient in saying like, hey, we can do your eligibility once the copay appears. Hey, can you afford this? If not, then we can go through a patient assistance program. If there's a rejection, they are able to like, hey, there's a prior authorization. Let me work this angle for you, whether go through Cover My Meds or so many other different integrations. But that's where the scope of this practice is, right? It's not just filling a prescription and dispensing it. There's so many different things that go beyond between them.
All right, I'm excited about something. I'm announcing it. This is the first time at Pharmacy Podcast Network has talked about it, and Ketan doesn't even know I'm about to say this, but we have a celebration happening later this year that's the first inaugural PrimeRx user group conference called Explore. So talk to our listeners about that event.
Oh yeah, we are super excited about this particular event. This is the first time in a little bit over 30 years that we are actually creating our own user group meeting. We have a awesome group of users that have been supporting us and have been using our platform for so many years, and this is a chance to get all of them together into a room, bring in special speakers, also give them a little bit of glimpse into what we are doing with AI, what kind of platforms we are building, how do we do automation. Yes, sure, there's like 5 different ways to do a refill, but what does data show? What are the best practices to manage a pharmacy? How can you reduce your reliance on technicians and instead of putting them behind the computer, how can you take them in front of pharmacies, show them that if you're opening a pharmacy, is it possible to literally like open a pharmacy where there is less touch points and there is more consultations, and just talk more about well-being, talk about delivery systems. How do you make sure that what is the best way to optimize a route, get the prescriptions there delivered fast? How do you divide your territories into zones? How do you print your shipping? I mean, like a whole variety of things. The practice of pharmacy has literally changed in front of our eyes over the last 3 decades, and we feel like this is the perfect time to bring all our users together, give them a chance to speak with each other, see what works in one pharmacy versus another, and for us to bring in a variety of speakers so that way they can learn from the best. I'm excited. You're going to hear more about this event on the Pharmacy Podcast Network. We're going to be bringing Ketan and some of his team members, and actually some of his clients. I say patients. It's your pharmacies out there using it to talk about the upcoming conference. Go to PrimeRx.io. Once again, PrimeRx.io. Thank you so much for making time for us here, Ketan, at the Access 25 Access to Pharmacy Conference. Absolutely. It's always a pleasure to be with you, and I'm super stoked about the fact that the listeners are getting to get a chance to see a complete different variety of speakers on your platform. Thanks, Doc, for having us.
Thank you. Access access to pharmacy, or I should say access to specialty pharmacy. We're here at Asembia 2025 with Joe DePinto. It is so good to see you. I said as you walked up to the booth, last time I saw you was last year.
Great to see you again, Todd.
It's nice to see you as well. So you taught me some things last year during the 2024 Access to Pharmacy, and that was where we are with gene cell therapy. And I can't believe it's been 12 months, but so much has happened. I really want you to give our listeners an update from McKesson's perspective. Introduce yourself and let us know what is going on in gene cell therapy.
Yeah, Todd, so thanks again for having me. It's great to come back. 12 months have gone quickly, and the space continues to evolve in cell and gene therapy, and a lot of exciting news, approvals, progress in the evolution both clinically and commercially. And the great news is more patients getting access to cell and gene therapy, groundbreaking science, and we need to make sure that that continues to accelerate. And that's why we're here, to make sure that that continues.
Give us an example of what disease state comes to first in mind where this is having the most success.
Well, whenever you think of cell and gene therapy, I think everybody really moves to hematology, right? Okay. That's where the jumping off point was. That's where many of the products that initially launched were in late stage hematologic malignancies and even non-hematologic malignancies. The excitement is pipelines are full in pharma of non-hematologic malignancies, non-hematology. Areas like autoimmune disease, cardiovascular disease, neurology, really big patient populations, which is really exciting for patients and for biopharma as the science continues to evolve clinically and eventually will launch into the commercial space.
When I think of the relationship between the pharmacist, the physician, our quarterback of the healthcare plan, the patient, the most important part in the entire thing, I think of how pharmacists can make some adjustments during therapy, maybe during a titration time, or adding something to their therapy to make them feel better if they were experiencing some, nausea or something like that. When I think of gene cell therapy, when does the pharmacist step in and start talking with the physician and the family and the patient to say, hey, this could be a really good option?
The pharmacist is a critical component of the treatment team for cell and gene therapy. Remember, predominantly what we've seen in the early phases of cell and gene therapies is being done at academic medical centers. The good news, in the last 12 to 18 months, we've seen an expansion to community. And pharmacy will play a role both in academic center and the community as patients continue to get both commercial and clinical cell and gene therapy. But a critical component of the treatment team the pharmacist plays.
Absolutely. So what are some of the challenges that you're seeing where gene and cell therapy is starting to lessen the log jam that always happens within the world of rare disease and specialty pharmacy?
Yeah, so, in the last 12 months since we last talked, I'll say that we've seen a continued trend towards moving cell and gene therapy more towards community, both community hospitals and even some community clinics. And what's occurring is more and more of those community hospitals are looking at alternatives. A, they can buy and bill the product, they can bring the product in. B, they can use specialty pharmacy to white bag these products. And we're seeing more and more optionality being explored by these community hospitals for a variety of reasons. And that's the great thing about being here at Asembia. It's a who's who of specialty pharmacy.
So McKesson has an intimate relationship with the pharmacy markets. They're all over the place. They have the technology platforms. They obviously have the wholesale division. The trust that you've built with the community pharmacies, the trust that's been built with our senior care pharmacy consultants, this is very important. So when I think of gene and cell therapy as a question mark in the patient's mind, I look to the pharmacist to start clarifying and building additional trust. Talk to us about that element and the uniqueness that McKesson brings to this market.
So last year in the fall, we branded our cell and gene vertical at McKesson, and we called it InspiroGene. That's the name of the vertical that really focuses at McKesson primarily on cell, gene, and advanced therapies. And we took that trust from the McKesson brand and we expanded it out with the specialty around all things cell and gene therapy floating through InspiroGene. There's a lot of trust being built there from a standpoint of all these services, whether they're solutions, technology, or specific for cell and gene therapy, and the pharmacist plays a critical component of that. The specialty pharmacy is part of our offering, as well as our standard distribution, patient logistics, and patient access.
So what challenges are you seeing in place that you think, hey, this is a perfect opportunity for us to expand gene and cell therapy into the treatment programs?
So, when you think about the explosive growth in healthcare and you think about the exciting spaces, they're typically driven by strong clinical data. Cell and gene therapy has really strong clinical data. And it's in areas of high unmet medical need. So that's an exciting phase. But how do you take this really complex science and scale it and bring it to the masses in a consistent fashion when they all act a little differently? Cell therapies act differently than gene therapies, right? And what we do at InspiroGene is we help the ecosystem as an ally solution for that complexity, so that way the healthcare professionals, whether they're clinicians or pharmacists, can have a streamlined, democratized, industrialized, whatever adjective you want to put in there, that really talks about consistent utilization of a product, which is really critical, so that the right product gets to the right patient at the right time. Yep. And we do this always for the patient, and those patients benefit from that significantly.
All right, lots of specialty pharmacists listening right now, lots of people in this space. What's the best way to reach out and get a hold of you, Joe?
So you can always get a hold of me at inspirogene.com. It's our website where the specialty pharmacist will find resources, both clinical resources, commercial resources, latest news on cell and gene therapy, and some of our solutions and some of the technology that we've been developing in the last 12 months to really help navigate the value chain.
You're also on LinkedIn. So
absolutely on LinkedIn.
Reach out to Joe DePinto at McKesson Specialty Pharmacy Services on LinkedIn, at the website. Look down on the show notes. You'll see the link right there to the landing page that Joe mentioned. Joe, thanks so much for being part of this.
Okay, buddy. Thank you.
Hi, this is Heather Bonome, Director of Pharmacy with URAC, and you're listening to the Pharmacy Podcast.
Heather at Access 2025, Assembia 2025. It's so good to see you.
You as well. Great to be here.
Not the first time you've been on the Pharmacy Podcast. We've talked to you a couple times, actually, and the importance of URAC, the importance of keeping up with what's happening in the profession, accreditation, how important that is to us as an organization and profession. And we're here at Specialty Pharmacy Focus. So right out of the gate, we need to get into this. And how is URAC tied into specialty?
Oh, absolutely. Pharmacy is a core part of our accreditation. We accredit across the healthcare landscape, but I oversee the pharmacy portfolio, and really 90% of the reviews that my team does, my team of pharmacists do, are in the specialty pharmacy space. It's critical to the industry. It's really setting the standards, and pharmacies that are accredited for specialty pharmacy, it's really what defines them as a specialty pharmacy.
Nope. When I think of a manufacturer who has a specific complex medication, it's sensitive, it's timely, having to get the patient on it as quickly as possible. They have standards. Where do the standards to build accredited specialty pharmacies, where does it start?
Yeah, so all of our standards really come from the industry.
Okay.
We have advisory groups that are made up of industry experts, and we have a couple. We've got standing advisory groups that we can go to all the time. And then when we're creating a new program or when we're revising a program, we'll stand up ad hoc groups. In fact, right now we are revising our specialty pharmacy standards. Okay. And we have put some standards out for comment. And based on that comment, we are now reviewing with this special specialty advisory group some ideas that we have for updates to the standards. And so we pose that to them, and we host sessions where we get feedback. Live feedback, more written feedback. It's great. We do a series of those meetings. And then, in fact, we did a pre-Assembia conference on Sunday afternoon where we invited current accredited organizations to come in, and we did some education, and then we spent the back half of that meeting, and it was a whole afternoon, getting feedback. Hey, if we update it to this, is this realistic? Is this really best practice? What would be the impact to your organization? What else would you like to see? So it was a really great interactive session where we're hearing directly from the industry what these standards need to be, what should we change, what shouldn't we change, and it was just a really great opportunity. And we can do that because all of specialty pharmacy is here. Not all. A lot of specialty pharmacy is represented here, and it's just this great opportunity for us to bring everyone together to have that conversation.
Heather, talk to me about timing. I think of if I take my driver's license, it expires, I think in Pennsylvania, I think it's 5 years. So is there a realm of, if I'm a certified URAC specialty pharmacy, is there a cycle of time that I have to be recertified?
Yeah, so our accreditation programs are all based on a 3-year cycle.
Okay.
So you get accredited, and you need to maintain compliance with all the standards throughout those 3 years. And then about 6 months prior to you expiring, that's when we really start the work of the reaccreditation process. And so then you go through the accreditation process again, having the knowledge of the standards, but then also complying with, any new updates and things like that. But every 3 years, we get to go through the review process with our accredited pharmacies.
From a URAC perspective of understanding the pitfalls of not having the accreditation, what problems that could cause, do you have any mock audits that are ever happening with any of your accredited pharmacies where you're either giving them guidance as to where to go to get a pretend audit done, or you doing it yourself?
Yeah, so we don't do mock audits ourselves. We do a lot of education. So as an accrediting organization, we review, we survey. We, as an accredited organization, and other accrediting organizations have done different things. We've made a decision not to consult. But we focus a lot on education.
Okay.
So we do meetings like here, because we did some education as well. We have a whole client information hub where we have standards webinars. We have, tips on the process webinars. We hold live webinars for our clients. So we do a lot of education to help to get them prepared. The audit question is a really good one because we do suggest that organizations audit their files, audit your patient management files, audit your HR records, just to make sure you're going to have everything in advance. And some organizations have figured out really good ways to do that themselves. And certainly, there are many consultants, like accreditation consultants in the industry, that help organizations get accredited, and they have their own mock survey tools that can be really helpful to help an organization get ready for, just even to know what to expect when we're going to do our review.
We're here at Assembia, obviously, but URAC is all over the place. You're in so many facets of the profession. Talk to us about the expansion of URAC in other sectors of pharmacy.
Yeah, no, you're absolutely right. I mean, we started with utilization review and health plan and case management, disease management, so we do all of that. Then, the pharmacy is my whole world, and we're doing a lot of really exciting things there. And then, other things around maybe a few years ago, we launched our health equity accreditation, which any healthcare organization can pursue and achieve. And actually, here at Assembia, our CEO, Dr. Sean Griffin, was on stage with CVS Pharmacy, who was the first organization to achieve that accreditation. Really exciting. It was a great conversation just because, I think we stood up the program for the right reasons, and they sought and achieved the accreditation for the right reasons. So that was really exciting. And we're seeing a lot more interest in that health equity space. Something else that we're just getting ready to launch is a healthcare AI accreditation.
All right, you ruined my next question because I was going to say, what's the impact of AI on accreditation? So there, you stole my thunder.
Yeah, so it's something that we're really excited about, and we put out a call for participants in an advisory group to participate in that. We got a ton of interest. We couldn't include everybody. We got so much interest. Some very big players players in the industry, both from tech as well as from healthcare,
That's cool.
are going to be part of that, and we're going to be launching those. So that program is going to be stood up and also launched later this year. So really exciting.
You have to come back on This Week in Pharmacy and talk to us about that specifically, so you're going to get an email from me as a follow-up.
I like it. I'd be happy to.
Thank you, Heather. This is so special to be able to be with you here at Assembia 2025. We hope to interview you at 2026.
Sounds great. I'll be there.
Hi, this is Jill Pellier from Specia, and you are listening to the Pharmacy Podcast Network.
Jill, Access to Pharmacy 2025. What an exciting time to be together. I like to say Together RX. How are you?
Good. How are you? It's so nice to meet you in person.
Yes. It's funny how LinkedIn is really my first bridge to building contacts. And I've connected with more pharmacy professionals in my 22 years in healthcare through LinkedIn than I think any other platform. What about you? What platform do you use?
Definitely LinkedIn. I love connecting with people on there. I love seeing what everyone's doing, especially people in non-traditional career paths, entrepreneurs, anyone in specialty pharmacy. We can nerd out about the same thing. So
exactly, nerd out's the right way to say it. So we're nerding out now on specialty pharmacy specifically. Tell our listeners what your organization is doing, how you're connecting into specialty specifically.
Yeah. So I've been working in specialty pharmacy since 2007, so quite a while. And right now I'm working with Specia. It's special without the L. And we write specialty pharmacy disease-specific workflows. So basically what that means is that specialty pharmacies need to have workflows by accreditations like URAC and ACHC. And the workflows will guide the pharmacist through the initial assessment process, education and counseling for the patient, and the reassessment process. And they have to hit all these certain points for those assessments and counseling that's required by accreditation. And they need to have a workflow that guides them through those assessment activities that are disease-specific for all the different conditions that they treat. And so we write the content for those workflows that pharmacies can implement into their existing software platform. Rather than creating that content by themselves and updating and maintaining it, we provide the content for them to use while they implement the program themselves.
All right, so now you're starting to flick on the lights in my head based on, I know exactly kind of what you're dialing into. So back in the day, in 2004, I worked for the first SQL-based pharmacy management system that was dedicated to institutional and long-term care pharmacy. Shout out to Framework LTC. And they concentrated just on that space. And then all of a sudden they would start adding in, as the years progressed, ways to manage bed sore situations or best practices for this medication or some of the warnings that are tied into this, like a whole track. So then when I get into specialty, because Assembia, before it was Assembia, it was Armada Health, and what an amazing organization, what an amazing time that we're here now. This is my favorite business conference in specialty. But when I was in specialty pharmacy, we had Theragy, Assembia One, Keycentrics, where they were building workflow that was matching conditions and disease states and REMS reporting and other things that were very specific to the condition in the NDC and the specialty med. So expand upon that, and let's talk about jettison. I stopped selling pharmacy software in 2012 or something. So a lot's happened since the API world. It messed everything up all the time. But tell us about how you're fitting into that ecosystem.
Yeah, that's a great question. So there are definitely some great software solutions out there right now. You mentioned Theragy, Assembia One. Those are some of the popular ones that it's a software solution that has these workflows and clinical content in the workflows already. However, some pharmacies want to use whatever software system they already have.
Yeah,
so if they have a pharmacy dispensing system, if they have an electronic health record, they would rather document in their current system.
Yep.
However, that means they have to develop all the content and the workflows, making sure they're clinically robust, not too much information that it's overwhelming. We don't want to drop the whole package insert in there. And also not too little information that it's not helpful for their pharmacists on a day-to-day basis. So they have to develop clinical content for each of these disease states, and then they also need to make sure that the workflows are going to going to be supporting accreditations and making sure that they're hitting all the boxes that they need to hit to be compliant with accreditation. So instead of pharmacies recreating the wheel and each creating their own workflows, we just develop the content. So we're a little bit in between the software solutions that have everything, software plus the content, and the pharmacies that choose to develop their own workflows in their existing platform, and they create the content. So we're kind of in the middle creating the content that they can implement into their own system.
So I see so many evolving community pharmacies that either get into compounding or specialty pharmacy, long-term care, additional business steps. I could see a well-versed organization, like a shout out to Chris Antipas in Pittsburgh, who has a specialty pharmacy, and I'm going to tell him about you. And he wants to build a custom system internal to the way that they do business, the payers that they're in touch with, pharmacogenomics information, things that some of the systems just don't match up. So when you think of these custom organizations, I think of JB Consulting, who's on our board of advisors. Shout out to Sean Jensen. He helps to kind of marry these systems together and then be able to take workflow, remote patient monitoring, adherence systems, and then your deep dive understanding of a specific disease state and the medication and kind of best protocols. I love it.
Yeah, so ours is great for pharmacies that want to develop their own custom platform in their own system, or even develop their unique software, because we provide the content that will give them a starting place for making sure that they're clinically sound. They are written by specialty clinical pharmacists and peer-reviewed by practicing specialty clinical pharmacists, and also making sure it's meeting the accreditation standards. So that's the basic backbone of what they need, but then they may want to customize them as well for payer requirements, manufacturer requirements, etc. And so they still need the content to put into their existing system. So our workflows are a great place to start, and certainly can be developed further to meet specific pharmacy needs and preferences.
All right, specialty pharmacists, specialty pharmacies, directors, operations, people that are listening right now, and you've piqued their interest, how do they reach out to you?
Well, I'm on LinkedIn. Very easy to find. I think I have a unique name. It's Jill Paslier, Paslier. Otherwise, it's you can check us out on the website at SpeciaRx.com. So it's special without the L, SpeciaRx.com.
That's awesome. Thank you for being part of Access to 2025 here in Vegas. Assembia, this was special. Thanks for doing this.
Yeah, my pleasure. So nice to talk to you today.
One of the podcast hosts of Marketing Vitals, Nicolle McClure, is here with me at Access 25, Access to Pharmacy here at Assembia. Nicolle, it's always good to see you.
Good to see you. Thanks for having me on.
Absolutely. So one of my favorite things in the realm of pharmacy since I entered a long time ago, over 20 years ago, is communications, marketing, positioning, branding of not only the services that I was representing specifically around technology and APIs, but processes and programs. And so when you entered specialty, it's been a long time, but you've been really aggressive about it over the last 2 to 3 years. Finch has emerged as that company that's really helping to marry the output, the pharmacy itself, to a better mousetrap of marketing and positioning. So talk to our listeners a little bit about what Finch is doing here at Assembia.
Yeah, so we're excited to be back. It's our second year, and it's great to just be in the specialty pharmacy realm because we've been in community pharmacy through our sister company, GRX, but to grow more on the Finch side with specialty has just been great because I think it is definitely evolving, and a lot of community pharmacies as well is getting into the program. But through Assembia and some of our Finch clients that we've been working with is just offering that really targeted approach for specialty pharmacy in the sense of being able to directly hit prescribers that they're trying to target. So if they're trying to promote like a specific drug or program that they're using, we can really narrow down that marketing for them to prescribers by specific specialty in a certain hospital. I mean, we can get very granular, which I think is awesome and a great way to show these companies results over just more ambiguous marketing techniques.
It's a double-sided weapon as well, because not only is GRX supporting the specialty pharmacy in and of itself, but also the vendor who is marketing to the specialty pharmacy so that you can really hone into their messaging and brand. Talk to us about kind of both sides of that.
Yeah, so it's, like you said, it's definitely a two-prong approach where we can help those kind of B2B vendors that are looking to market, but then bringing those opportunities down to our community pharmacy clients through GRX, because we do have a lot more of those entering the specialty pharmacy arena. It's kind of that specialty light mid area between full specialty and retail, just because of everything that's going on in the industry. I think they're looking for other opportunities to grow their program. So as Finch grows and continues to bring on more of these B2B clients, it's just a value added for our GRX ones, because we can say, hey, we've partnered with this great company, check out their services, and we can kind of help through that whole funnel.
All right, so what challenges are you seeing in specialty pharmacy specifically in comparison to your experience, the sweet spot where you started, which was community pharmacy?
I think it's just for specialty pharmacies. I mean, in some way, it's related to community pharmacy where they're trying to break through with their larger competitors. So, like how community would with the chain pharmacy, because there are bigger specialty pharmacy type companies out there, and we're working with some of the smaller ones. So helping them kind of break through that clutter or that larger focus has been a challenge, but it's definitely like independents. They bring so much more to the table, so much more personalized concierge type services. So helping them bring that messaging forward to hospitals, prescribers, other manufacturers, things like that, has really been, I think, valuable for them, and just uplifting their message and help getting it out more.
Nicolle, before I let you go, I want you to tell the story that you were talking to me about before we started recording, with a brand new specialty that you're helping out with their branding and positioning, not only from a national perspective, because they have 50 state aspirations, and God bless them, that's not an easy task, but also their local branding.
Yeah, for sure. So they're a brand new specialty pharmacy. It's called Rare Specialty. They're on the East Coast, and we actually help them create a logo, from the very beginning, and launch their website, but really hone in on their local marketing, helping them connect through prescribers. And we did that through, again, that targeted marketing approach. So either email addresses, so emails are going right to their doctors, and it's the actual first-party data. It's not, info@hospital.com. But then we can see those results if that specific doctor opened that email, if they interacted with the email in any way. So that type of information we can pass along to the client. So we're doing that with Rare Specialty, along with some LinkedIn ads and other type campaigns. And it's really helped them kind of grow their local presence and get their name out there, because it's been a two-prong approach of just branding, so helping their name get out there, but also honing in on specialty, certain drugs that they're really trying to push with prescribers. So it's been fun to watch them evolve and grow, and then as they continue to push west and get that 50-state licensure, we're excited to be a part of that journey along the way.
All right, listeners listening right now, they want to reach out to you. What's the best way to get a hold of you?
They can reach us at finchmarketingsolutions.com.
finchmarketingsolutions.com. You heard it here. Access to Pharmacy 2025. Thanks, Nicolle, for being on the show.
Yep, thank you.
Pop quiz time. What year was the Pharmacy Podcast Network founded? Superfans got this one right away, but we give everyone a second to think. If you said 2009, well, thanks, loyal listener.
The internet, my gosh. I remember, 1999. I was in telecom. I was selling something called Frame Relay, which is one of the most boring things I've ever done in my life. And then the internet comes out, and it kind of changes literally everything. A relationship that I have with a friend that I've watched her family grow up is Chara. Welcome to Access 25 Access to Pharmacy and our post show, Chara. It's nice to see you.
Great to see you too, Todd. This is exciting.
Isn't it funny how social media has, in one way, in my opinion, as I'm a parent, just like you, I think when you and I grew up, we didn't have it, but then we add it to our lives now, and I think it means more to us as people who knew how to communicate without it, whereas now, you know, I got to meet you through in watch your family grow up and watch your successes at Cencora and watch your own career growth. That means something to me because I'm the same professional as you, so I want to see you having success in your space. But then I think of my kids, and they've saturated in internet and social media for so long. But what do you think about that whole thing as a parent in the world of internet?
Yeah, you know, that's interesting to actually think through. Kind of being that sandwich generation, kind of growing up without the internet, and then getting to a point in very early adulthood, late teens, depending on your age, where there becomes social media, and it changed. Literally, it changed our lives, you know, in ways I don't think we ever could have imagined. I definitely do remember when connecting with someone on the internet that you didn't actually know in real life was a little bit creepy.
Yes.
Like, it wasn't a thing that, like, you were just like, ew, I don't know this person. Why are they trying to be my friend? Like, that's weird. And to change, like, this is the way that we connect. And taking that back to our kids only knowing this way to connect, I mean, we still do have to put a lot of guardrails because they are children, right? And so there are, you know, there could for sure be things that people we don't want them to connect with, but they're so trusting because this is the world that they've grown up in. So I think it still gives me a pause of what's safe, you know, for children to do, but then also have a true appreciation on how connected we can be, and through these connections, how we have been able to do so many incredible things for patients and patient care because of the arc of learning. We've taken that runway, and it's now a step, which I would even boil down to say it's now a click. Truly, it's a click, you know, which is just wild. It's mind-blowing, but I think in a really good way. But it will be interesting as we see how these kids who kind of just grew up with this being part of their life, how they navigate early adulthood and their careers. And I do also wonder if it'll go backwards a little bit, where they actually do want more in-person connections than so many virtual connections. I do wonder if there'll be some sort of path backwards.
Yeah, I agree. And I'm seeing shifts in how we work as professionals. We are at Access 25. Asembia is like the Super Bowl event of specialty pharmacy business. Cencora, a.k.a. AmerisourceBergen, has been a supporter of this event forever. And your career has blossomed and has changed and has evolved. I think I've been connected to you for like 10 years now, and it's just amazing to see you make the corner and you come and walking down our aisle. And I was so excited to see you because we don't get enough time together in person. We're always just defaulting to our internet connection. But talk to me about the importance of being involved in the Super Bowl of a specialty pharmacy.
Yeah, this really is the Super Bowl conference, and this is a conference that's truly near and dear to our organization because of the connectivity that it brings. That instead of us doing what we do so often, being virtual, it does allow us to have those in-person connections and meetings and whiteboarding and brainstorming. Because truly at Cencora, our goal is to create healthier futures. That is our responsibility, and we take that charge very, very seriously. And we are a proud sponsor of this conference because it helps us do just that. And we know that the impact that we all have collectively together by attending the sessions, by walking the exhibit hall, by sitting in the meetings, by even breaking bread. I mean, I've had so many great grab a coffee, grab a lunch, go to dinner, conversations that excites me for when I go back home and on Monday I get back to work and think through the learnings that I've had, the takeaways that I've taken out of meetings, the new connections that I've had, and the reconnections to people that I've known that I just don't get to see that often. I think it charges us all back up again to go back on Monday and take back some things that are going to be important for us as we do move forward with our workday. And truly, I don't think there's any person that's here that's not here because they know that at the end of the day, what happened here is going to impact patients' lives.
True.
And that is extremely important to me.
Yep, and it's the support of the professional. We are leaving our families, we're leaving our comfort zones, we're coming here. Vegas is not an easy, place to get to per se in some ways, and but when we get here and we fuse together, we start brainstorming together, there's an energy. And something that Cencora did this year at Asembia that was very special is you set up a professional photography group in your booth so that someone that wants to change their LinkedIn profile or they want to do something with this headshot, that's important in being able to show yourself as professionally as possible, and that brought a lot of attention to you guys.
Yeah, I thought it was a great idea that our marketing team decided to do the photo booth this year, and I did go down there and I was with a colleague who got new pictures and they looked amazing, and so I'm excited to see her new pictures. But we also got to connect with people. We got to connect with some colleagues that were standing down there. We got to connect with some Asembia team members that were down there to get their pictures taken. And so just while standing in line, you are still connecting, and even though it sounds very simple, to go get a picture taken, I think it still provides another way to connect and do what we do best in healthcare. And these connections are truly, you can't put a price tag on it. It's been priceless.
Absolutely. Chara, Reid, Cencora, special to see you, spend some time with you. Thanks for being part of the Access 25 post show.
Thank you so much, Todd. This truly been my pleasure.
Thank you. Donnie's back on the pods. It's great to see you.
Thank you, Todd.
We were in Nashville last time. Now we're here in Vegas. I hate Vegas, by the way. I'm just going to be honest.
Did you lose all the money again?
No, it's not that. It's just not my vibe. Like, I'm a beach person, so why can't we have this in Naples or, on San Diego or something like that? No, this conference is my favorite specialty business conference because people come here to do business. This is their entire mind. They're not here for clinical per se. There's a little bit of that sprinkled in, but this is about let's execute. Let's do things that are going to make sense for our patients. So when I think of RX for Route and what you guys are doing for logistics and technology in the specialty space, talk to us about how your organization has stepped up and really helped out specialty pharmacy.
With us helping with us to the specialty pharmacies is the main key point of RX for Route is obviously the handling deliveries and helping specialty pharmacies with everything regarding deliveries from top to bottom, starting with the signatures and ending with delivering the cold packages.
I also think, Donnie, about your integration with the pharmacy management systems that are out there. Talk about those relationships because that's super important.
Sure. We are integrated with all major PMS systems that are out there. Pioneer, Prime, SuitorX, BestRx, McKesson, all the PMS systems that are out there. It's a two-way integration. It's the best integration that's currently on the market. None of the other companies have what we have. The relationship that we've built not only with the other pharmacies, but as well as other pharmacy software management. That's how we were able to get the two-way integration that helps pharmacies sufficiently cutting the cost by saving the time on creating the orders and helps them with the audits as well because the signature is coming back. You don't have to worry about anything.
All right, so especially a little bit different of a beast. I'm the prescriber. I execute on the medication. I want this thing filled and I want it to my patient ASAP. So talk to me about the environment of what Rx for Route is doing specifically in specialty to ensure that that patient is on the med as quickly as possible.
To ensure that that person is on the med as possible, us compared to all the other delivery systems that you might have or that you might use or that you might heard of, we are specifically designed only on delivery medications. And we've built it only for the medication. We don't deliver food, we don't deliver clothes, it's only for the medications, right? So as well as creating the orders, there's a bunch of different steps that you can take. There's a bunch of different settings that you can toggle on and off to make sure that the software is really optimized for your needs. It is not a one shoe that fits all. We come in, we toggle all the settings, we make sure that if this patient is a stat, whenever you create this patient or whenever you use this drug, our system will automatically consider it as a stat order and make sure that the patient gets it as soon as possible as they need to.
Is this Rx for Route's first Assembia?
Second
Assembia. So in differentiating from going to NCPA, APHA, some of the things, what do you think about this event specifically for specialty?
This one is more of a networking event, I would say, and more oriented for specialty pharmacies. I haven't had any long-term care, any retail, any of the other pharmacy specialties. And I think this is one of the best conferences that a specialty pharmacy could attend.
Absolutely, and you just shouted out the different sectors that you help, not only in delivery and logistics, but also your sister company that focuses on staffing, which is how you helped the Pharmacy Podcast out over at APHA 2025. So if you are listening right now and you're interested in working with Donnie, give them the best place to go to learn more about your organization.
rx4route.com.
rx4route.com. We're going to put it in the show notes. Donnie, once again, thanks for being part of the show.
Of course. Thank you, Todd.
Chris Corsi, Cassian Health, CassianRx. We're at Assembia 2025. I want to jump right in. We've talked before, but I want to know specifically around specialty pharmacy. Give our listeners the connection of how CassianRx is dialing into specialty specifically.
Yeah, definitely. So Cassian has a purpose-built end-to-end specialty platform. And with that platform, we're connecting all the different stakeholders. So we have the physicians, the patients, and the pharmacists all working in the end-to-end platform and have streamlined communication channels between all of them to help accelerate access, to improve adherence, to do everything that all the different stakeholders are looking for.
Is this based on a system that would have an API to another pharmacy management system or an electronic health record?
Exactly, right. We fully integrate into your pharmacy dispensing platform or even EMRs, yeah.
Okay. And then where do you focus specifically on specialty? Have you found a disease state that you're managing in a special way? Are you finding logistics as the hurdle? Where is CassianRx? Where are you guys dialing into specialty specifically?
Yeah, we work across a lot of different disease states. We have a big immunology portfolio in oncology. That primarily those main two areas is where we have most of our patients. But we really cross-cut all the different disease categories and therapeutic areas.
When you're here at Assembia, where this is like the Super Bowl of specialty pharmacy business, what are you learning in a conference like this of where the gaps are to help patients get their medication faster, get information back to our physicians, report things back to the manufacturer with like REMS issues or REMS reporting, and then obviously really being concerned with workflow of how it's impacting specialty pharmacy operations?
Yeah, that's a good question, right? I mean, it's a tough answer. I mean, we see it everywhere, right? That's why we've kind of built that purpose specialty pharmacy platform, so it's all one end-to-end platform, because before, right, it was jump into this, jump out of that, jump into this. Yep. And when you have all those stakeholders all into the one platform, in sync and synergistically working together, you really alleviate a lot of those burdens. The patient understands where they're at through the whole PA process, all the way through their last refill on that script. The physician has a view, I like to say a window into where the pharmacy is at, where that patient is in that journey as well. So the physician is connected into that journey now. So you're building a joint care team between the pharmacist and the physician. So really, we're trying to alleviate all those barriers right now in that ecosystem with our platform. So, I mean, I think it's cut across everything, and I think we're helping in a lot of different areas there, especially facilitating and communicating. When you asked about the, burden on the pharmacy, right? Yep. How does this affect the pharmacy? being all in one system, right, it really helps the pharmacy. Like I said, you're not jumping in and out of different platforms now. We can integrate directly into your dispensing platform, or work standalone if you would just want to have side-by-side platforms. So we really try to put the pharmacy first and create the pharmacy as like the hub of all of the services and bring all of those stakeholders to the pharmacy so that the pharmacy can operate efficiently in that ecosystem.
All right, specialty pharmacist operations listening right now. They're listening to what you're saying. You're piquing their interest. What's the best way to reach out to you?
Shoot me an email at chris.corsi@CassianRx.com.
Excellent, excellent. And then you're on LinkedIn, so look up Chris on LinkedIn as well, CassianRx.com.
Yep.
Thank you. Big part of specialty pharmacy, something very important, is when the patient runs into a brick wall when it comes to their finances and being able to get things paid for. And this network has been very sensitive to things like that. Very excited to run into Michael Heimal, who is the CEO of HealthWell Foundation. Michael, welcome to the show.
Hey, thank you, Todd. Thanks for having me.
All right, let's get into this. So, boy, I have 4 daughters, so I think if one of my daughters were sick and they needed a specialty med, it starts putting financial pressures on my family. That in itself creates even more problems than other things that are taking place in her health. Talk to me about those kinds of stresses on people out there who have some kind of rare disease, need the assistance, and how HealthWell Foundation is helping out.
Yeah, thanks. Financial toxicity is a real problem in the healthcare industry and creates a lot of additional problems beyond the disease that the patient may be suffering, whether it be mental health, stress, lack of sleep. What we know from surveys, we recently surveyed 1,000 of our patients. 41% said without financial assistance they would not be able to take their prescription drugs. 37% of those patients told us that without financial assistance from a foundation like HealthWell, they would change their grocery habits. So they would have a lower nutritional status. And we see this unfortunately all the time with cancer patients, autoimmune patients, patients with rare diseases, where they're making choices between taking their prescriptions as instructed or paying their rent, buying healthy food, and a number of other things that help them. And so there's really no need for somebody to have to cut a pill in half and not take it as prescribed when there's organizations like HealthWell that can offer financial assistance.
Michael, talk to me about how you work with specialty pharmacies to get them to understand what your programs are and then where to insert them into the ecosystem of everything that's happening with that patient's life.
Yeah, pharmacists are incredibly important to our ability to help patients because about 1/3 of our referrals come from the pharmacy community. And a pharmacist having a patient at the window or counseling a patient in a clinic or in a health system where that patient can't afford the medication and they see the price for the first time needs to know that there are resources out there to help those patients. And so about 33% of our referrals come from pharmacists. Another 1/3 of our referrals come from provider organizations. So it's absolutely critical that we continue to get the word out about HealthWell to the pharmacy community and the specialty pharmacy community in particular so that we can continue to help patients.
Excellent. So talk to me about the extension of your reach, specialty pharmacy. Are you also assisting in the community space or long-term care pharmacy? Does it really even matter?
It doesn't matter. Wherever the patient need is, and building a network of people who have access to patients who need help, most commonly pharmacists, but providers, nursing case managers, social workers that all work in the chronic disease and rare disease space assisting patients are critical to us. We spend a tremendous amount of time building an alliance network of a number of different nonprofit organizations that can assist. We've been in conversations about joining the National Association of Specialty Pharmacists so we can get our word out better. In fact, I'll be meeting with their team while we're here at Assembia this week. And then offering portal accounts into our system for specialty pharmacies so that we can streamline the process. The pharmacist can help enroll the patient in one of our disease funds, and we can get the copay into the hands of the pharmacy or the patient right upon approval of the application.
Michael, the Access to 25 conference, Assembia 2025, is my favorite business conference in specialty pharmacy. Other than the NASP, shout out to Sheila Arquette. Actually, NASP is a part of our network. We value all the data, all the information that she brings and her team brings. They're just amazing. But what are you looking forward to at this meeting this year?
This is my first Assembia. I spent 38 years working in the hospital and health system space. I joined HealthWell about 6 months ago, and I'm still learning more and more about what we do as a foundation to help patients, and really about some of the challenges within the specialty pharmacy community. And so connecting with as many people as I can, building those networks and listening to what providers here our patients need so that we can then work to expand the funds that we offer to patients.
That's wonderful. Michael, thank you for being part of the post-show here on the Pharmacy Podcast Network. We appreciate this.
Thank you very much, Todd.
Pooja, it's so good to see you. I only get to communicate with you on the world of LinkedIn, which is great because at least we get to meet. But we don't get to see each other in person lots, and I love talking with you in person.
Yeah, it's great to be here. Thanks for having me on.
All right, so you've been on the show. It's been too long, so now give us an update. What are you doing with NCPDP? And, I mean, that was a marriage made in heaven for you to match up with them. So talk to me about that.
Yeah, it really was. I think the last time we spoke, I was still with Point of Care Partners doing the consulting thing. So back then, you know, I was doing a lot of industry work of trying to figure out how NCPDP could support the expanding role of the pharmacist, you know, kind of thinking more beyond the standards. And so when the role opened up to do this, it just seemed like you said, a perfect fit. So my role right now is to really be involved with the industry happenings, what's going on. Of course, we're always going to have our standards, but there's so much going on in terms of pharmacists supporting clinical services, care coordination, chronic care management, and we're trying to understand as NCPDP how we can support that either through our standards or through partnerships with, you know, other industry organizations, you know, bringing health plans into the fold, bringing more pharmacists into the talk about really what they need to support all those additional things that they're doing.
So we're at Assembia, specialty pharmacies at the mind. Talk to us specifically about NCPD's positioning in specialty pharmacy.
Yeah, so actually when I was just a member, I actually started the specialty work group at NCPDP. And the thing that we tried to do is come up with standards, right? We know that specialty pharmacy, there's other additional standards that need to be out there to support specialty pharmacy. So we have quite a few of our standards that support specialty, but also thinking about, again, kind of the clinical services that go along with the specialty medications. You know, you don't just dispense a specialty med. There's all sorts of additional services and follow-up and, you know, management of the patient that needs to happen. So I'm here really to learn and to talk to people about kind of what they're doing and how they're doing it.
That's good, because when we can fit this together under these standards, now all of the workflow companies are now on the same language. All of our pharmacy management systems, our payers understand the value more. Now we're connecting to getting things paid for. So it's the gel that I've watched come together through NCPDP on all facets of pharmacy. Started in my realm, and a shout out to Work Group 14 for the long-term care pharmacy. Shelley Spiro, just a shout out to Shelley. But now it's important to see where this is going specifically in specialty, because specialty is expanding.
Absolutely, it absolutely is, and it's great to, you know, I remember last year and even this year, there was never talk about prior authorization, right? We can do prior authorization electronically. I just came up from a session where they were talking about transparency and better understanding even the pricing of specialty meds. So all of that ties into our standards and the things that we do at NCPDP.
All right. How do people listening want to actually connect with you? I know you're big on LinkedIn, but how should listeners reach out?
Yeah, so reach out to me on LinkedIn. Otherwise, if you go to our website, ncpdp.org, we're actually just going to be launching our new strategic plan at our annual conference next week. So it's all about kind of clinical data exchange. It's about supporting the expanding role of the pharmacist. So you can go on our website, learn more, and contact us through there if you want to get involved. We have a lot of new committees, subcommittees, and a lot of focus on pharmacy innovation starting in the next year.
That's great. Excellent. And fringe benefit of this NCPDP. How often do you get to go to Scottsdale?
I actually live in
Scottsdale. All right. Well, that's one of the most beautiful places on earth, so I love Scottsdale.
And the weather's going to be good. So
all right. Thanks for being part of the Access 2025 show here at Asembia.
Yeah, thank you for having me.
Thank you.